All right, welcome everyone to the conference, and special welcome to all the new dentists and hygienists. I'm very excited y'all are here because it's great to expand your horizons and to learn new things because it'll benefit you, your patients, and your staff as well. So a little beginning how I got into biological dentistry. I've been practicing for about 30 years, and about 20 years ago, my boyfriend at the time was diagnosed with stage 4 cancer. So being the healer that we are, I started researching everything. And Austin is the mecca of alternative medicine, so I was learning Reiki, essential oils, I was making herbal tinctures, doing flower essences, essential oil, all these alternative methods. My acupuncturist friend even gave me needles and showed me how to do certain points on them at night. Well, at the same time, there was a local MD in town that was doing chelation therapy, and he asked me to go to lunch. And I'd heard rumors about mercury not being so great, but he sat down and explained to me how bad it really was. And I was pretty devastated, because by the time I was about 26, I was running a big office with about 5 dentists working under me. And we did a lot of dentistry. And all I could do was visualize those pools of mercury particles in the floor of the mouth, and I'm thinking, oh my God, that's a route of absorption. What was I doing? And he quickly nipped that in the bud and said, don't worry about it. You didn't know then. You know now. Just like Maya Angelou says, when you know better, you do better. And also at that lunch date, he gave me a big poster, framed, and it was all the tooth relations, the organ and the teeth relations. And mind you, this is the days before the internet, so it was a little hard to find out stuff. So I looked on the chart, and it was from our organization back when we were the American Academy of Biological Dentistry. I found the number and found out when the next conference was, signed up, and haven't looked back. So of course at the conference we learned about mercury, we learned about root canals, and of course fluoride. So that's what we're going to be talking about today. All right. What's a tooth made out of? The inorganic part, not the organic part. What minerals are in a tooth? Anything else? Okay, we've got our calcium, hydrogen, oxygen, and phosphorus. And that forms your lovely hydroxyapatite molecule. And I want you to note that nice crystalline structure, because it's very important. It's made that way on purpose. Does anyone see fluoride in the structure? No. Fluoride does not exist naturally anywhere in the body. There are no recommended daily requirements for fluoride. Fluoride is not essential for life. Decay is not from a lack of fluoride, it's a bacterial infection. Therefore, fluoride is a foreign object to the body and a toxin. Your body doesn't do well with it at all. That's why it says on the toothpaste tube, if swallowed, to call poison control. Now, average tube of toothpaste like that has about 140 milligrams of fluoride in it. Half of that tube will kill a 2-year-old. The whole tube will kill a 9-year-old. Conventional use of fluoride in dentistry. So we all had our topical application. But what happens is, if the enamel is demineralized, the fluoride actually deforms the tooth structure and it forms fluorapatite, replacing the OH ion with the hydroxyapatite with the fluoride ion. This messes up the structure, that nice hydroxyapatite crystalline structure. This creates a harder top layer, studies say, is only 6 nanometers deep. It takes 10,000 of these layers to equal the width of a human hair. So what happens is the remineralization creates hidden caries. Is anyone familiar with hidden caries? So, hidden caries, remineralization of the enamel over already existing decay in the dentin, or you can have decay happening because the remineralized enamel has lost its crystalline structure and it's amorphous and porous. The acids can move right through to the dentin, through that enamel. Even though it looks harder on the x-ray, it's more porous. So here's when you're doing your pit and fissure exams with the Explorer, and the Explorer won't stick, but underneath you can have decay. Right in there. And here is the interproximal caries. And this on the x-ray will look nice and solid, but you have your decay here. And that can be it can happen before the fluoride or after, or a combination of the two. So water fluoridation. All ADN, everyone touts how great water fluoridation is. But fluoride toxicity is cumulative. The more you take in, the more toxic it becomes. So water fluoridation does not decrease tooth decay. It delays its diagnosis due to the hidden caries. The National Institute of Dental Research found no statistically significant difference in decayed, missing, and filled teeth in fluoridated, partially fluoridated, or unfluoridated communities. The World Health Organization, the Center for Disease Control, from 1970 to 2010 has found that the DMFT rates have declined in countries with or without water fluoridation. And in the July 2009 issue of the Journal of the American Dental Association, Dr. J.V. Kumar states that children's caries rates are similar whether water is fluoridated or not. So why are we doing this? And here's a nice chart showing the decay trends. Looks like, I believe that's Iceland. They had like the biggest decrease, and they're not even fluoridated. The only fluoridated ones are Australia, Ireland, New Zealand, and the U.S. But all of them all the rates have decreased. So, my little flame, it's hot. Ingested fluoride is toxic. When fluoride is ingested or inhaled, it leads to corrosion of tissues in high concentrations. Fluoride combines with the hydrochloric acid in your stomach and forms hydrofluoric acid. And we all know what hydrofluoric acid is because we use it in our practice. It etches glass. You can't keep it in a glass container. It eats right through it. So that's what starts going on in your body. This corrosive hydrofluoric acid then goes throughout the body and causes damage. The National Toxicology Program calls fluoride a mutagen, something that causes genetic damage and cause or contribute to the development of cancer. Dr. Dean Burke, PhD of the National Cancer Institute states, in point of fact, fluoride causes more human cancer death and causes it faster than any other chemical. Fluoride is a halide. Y'all remember from chemistry, all the halides right there. So it easily replaces the other halides in the body. So boron, iodine, and chlorine. And of course the thyroid needs iodine. So the iodine in the thyroid hormones is replaced with fluoride, making them inactive, even though the levels may appear normal on blood tests. That's why you can't really go by blood tests. You have to go by symptoms with thyroid issues nowadays. And hypothyroidism is prevalent today. So here's your T3 and your T4 hormones, and see the iodine's everywhere. And the T4 gets converted to T3. The T3 is the active form. And it utilizes the enzyme with selenium. We'll go into that later to knock off the iodine right here to make it active. And fluoride also has an affinity for calcium, magnesium, and manganese. It'll create calcium fluoride, magnesium fluoride, and a manganese tetrafluoride, which is very toxic. They're actually pro-oxidants, not antioxidants, they're pro-oxidants. And fluoride also facilitates the uptake of heavy metals, your aluminum, your mercury. It can help them cross the blood-brain barrier. And that's not good for your brain at all. This contributes to some of the Alzheimer's and different problems with the brain. Other organs affected by fluoride. Your breasts. Your breasts, the prostate, and the thyroid are the organs that need the most iodine to function properly. Generally, if you have fibrocystic breast disease, it's usually from a lack of iodine. So take your iodine, and of course it can lead to cancer. So the prostate, same thing. Prostate needs iodine. So if you're flooded with fluoride, it's going to replace that iodine in those tissues and cause problems. salivary glands. It's going to create a dry mouth. It interferes with some of the enzymes in your mouth with your salivary glands for digestion. The fluoride on the pancreas, it interferes with your carbohydrate metabolism. It also interferes with some of the enzymatic reactions in the pancreas. It can raise your blood sugar levels and decreases your insulin. Skin, ladies, it causes wrinkles. Don't do any fluoride. If you go to communities where there's high fluoride in the water, you can see those people are a little more wrinkled and they're a little more bent over and crippled because you've got the bones breaking down, the collagen breakdown, and the joints, issues with the joints. Your stomach, you've got hydrofluoric acid in there. That's not helping your stomach at all. You can create nausea, vomiting. You know, have you heard of the kids that get fluoride treatments and they're vomiting? That's like their body's trying to protect them, but it's one of the first stages of fluoride poisoning. Hopefully you'll vomit it out so you don't get it in the rest of your body. It can cause diarrhea too, nausea, diarrhea, vomiting. A thymus, it interferes with the immunity of the thymus. Parathyroid. It messes with the calcium and with the parathyroid. And then you have this whole cycle with the kidneys, because you get the kidneys and the parathyroid work together. So if you have some kidney disease, and the fluoride can damage the kidneys, which is coming up next. The kidneys are the organs that detox the fluoride. So if your kidneys aren't working well, you're going to have more fluoride in your system. Well, the more fluoride in your system damages your kidneys even more. So you get this vicious cycle. So all the dialysis places know not to have one speck of fluoride in the water when they're dialysizing the patients because you'll really do damage to them. Your muscles. It interferes with the calcium potential in the muscles and also any of the protein and the collagen in the joints also. And the brain. It really affects the brain. So there are 43 studies linking fluoride exposures to reduced intelligence. In 2006, the National Research Council stated it is apparent that fluoride has the ability to interfere with the function of the brain. The Harvard Review of 2012 found a relationship with increased fluoride levels and decreased IQ. Now, some of these studies are in really high areas in China, and they have had IQ up to 25 IQ points decrease from fluoride use. The Lancet Neurology links fluoride to the increase in neurological problems such as autism, ADHD, dyslexia, and other cognitive impairments. And there seems to be a direct relationship with water fluoridation and ADHD. And here's a chart from Malin showing ADHD prevalence and water fluoridation. It also causes a reduction in the nicotinic receptors in the brain. It causes a reduction in the protein content. Since it's a mutagen, it's going to interfere with the proteins and deform them, so, which is in the protein expression. So that also, when all your genes are replicating too, it's going to damage those. You know, not only do you have to worry about the natural telomeres being broken down, but then it starts interfering with the rest of the DNA. It damages the hippocampus. That's the little part in the middle of the brain that helps you convert your short-term memory to long-term memory. And it causes inhibition of the cholinesterase activities and an increase in oxidative stress. And oxidative stress is known to cause cancer. That's why we take our antioxidants. And neuronal degeneration. It messes with the neuron itself. It interferes with the synapse, between the synapse and the end of the synapse, the space between the synapse interferes with the whole neuron. This is why it is imperative to not give fluoridated water to babies or small children. Because of their small size, infants can receive up to 400% more fluoride per pound of body weight than adults. The pineal gland. You all remember the pineal gland? That little endocrine gland, which is in the middle of your head, which produces melatonin. And it's also referred to as the third eye. If any of you are meditators, you'll know about the third eye. The seat of the soul, believed to be involved in reaching higher states of consciousness. And there's our little pineal gland right there. Fluoride causes calcifications called brain sand, or alcervuli, which are fluorapatite-containing concretions in the pineal gland. It calcifies the pineal gland, so then it doesn't function properly. And here's a picture, and there's the little brain sand in the pineal gland. According to Dr. Jennifer Luke, the pineal gland is the primary target of fluoride accumulation in the body, causing decreased melatonin production with sleep problems. How many people have sleep problems nowadays? There's so many commercials. Do you have problems sleeping? Can you not sleep? This is, I think, one of the main reasons. An earlier onset of puberty in females, and she showed this in gerbils, but you can see this nowadays, and the young girls are reaching puberty at a lot younger age. And then there's our dental fluorosis. We've all seen dental fluorosis. And 41% of the adolescents have dental fluorosis today, and African Americans actually have up to 56%. And here's their mild, moderate to severe. You know, the severe where you actually start having the tooth starts breaking down. And that's that brittle fluorapatite. Dental fluorosis is the outward sign showing that an individual has been overexposed to fluoride in their formative years. There's so much systemic fluoride in the body when the teeth were forming that fluoride was incorporated into the structure of the enamel. With that much fluoride circulating throughout the body, multiple organ systems in the growing child are affected as well, sadly. The skeletal system reacts similar to the enamel by replacing hydroxyapatite with fluorapatite. This creates a denser-looking but more brittle bone, which is easily fractured. And this is how the bisphosphonates work. Bisphosphonates are basically fluoride they're replacing the bone with. Some schools now monitor children in the sports programs who have dental fluorosis because they will have a higher incidence of bone fractures. Skeletal fluorosis also causes osteosarcoma. Now, this is more prevalent in young boys who have had fluoride around ages, they say, from 6 to 8 when their bones are growing, because fluoride will actually stimulate bone growth because your body's wanting to get the right bone, but it's making the wrong kind of bone. And then the bone that's created is not good bone because of the mutagenic effect of the fluoride. So it can create this is mostly in young boys from up to age 20. Spondylosis, degeneration of the spine. So then the nerves start getting pinched and you have back problems. Kyphosis, that's the old humpback. You see the dowager's hump in the older people, and that's from, you know, the back fracturing, healing, because the bone's more brittle. Crippling pain, everything heals and goes in the wrong place and pinches on the nerves, you're going to have pain, or it's not in the right place. And it can mimic osteoarthritis and rheumatoid arthritis. The prevalence of hip fractures in the elderly is believed to be influenced by water fluoridation. Fluoride also inactivates 62 enzymes in the body. Increases the aging process. We don't want that. Increases the incidence of cancer and tumor growth. 61,000 deaths a year are attributed to fluoride. And it disrupts the immune system. It creates genetic damage and interrupts the DNA repair enzyme activity. So, not just from your dentist or your water supply do you get fluoride, so there's other sources of fluoride. Since fluoride's used as a pesticide and to kill rodents and reptiles, it's in all your non-organic fruits and vegetables. And also the plants that are watered with the fluoride are going to uptake the fluoride and have them in there. So some of the highest concentrations of fluoride are found in grapes. Grapes are one of the most fluoride-sprayed fruits. And wine that's not organic is going to be full of fluoride too. So if you drink wine, I would drink organic wine. Tea. Tea readily pulls the fluoride out of the soil. So if you're going to drink tea, you need to do a young tea that hasn't been there so long. So a white tea, a white leaf tea, versus the green or the black teas will have less fluoride. Any drinks that are reconstituted with fluoridated water, such as your fruit drinks, your sodas, or your beer. And your Teflon cooking pans, fortunately they were banned this year because they contain perfluorooctanic acid into the environment, into the foods when you cook in these pans. Get rid of your pans. Any mechanically deboned meat, like chicken fingers or chicken strips or nuggets, because little bone particles are going to be in the meat and have fluoride in them. Fluoridated pharmaceuticals. Your bisphosphonates, Cipro's are really bad, full of fluoride. That's the antibiotic. Crestor is for your cholesterol. Januvia is a diabetic medication. Avodart is for bladder control. Lexapro is an antidepressant, and there's many, many others that are high in fluoride. And you need to watch the children's multiple vitamins. A lot of them can have up to 1 gram of fluoride in them. So if you're giving any vitamins to your children, check it out and get some new ones. They have fluoride in them. Okay, so now we've been all exposed to all this fluoride, we want to detox from it. So iodine. Iodine's a great detoxer because you want to get rid of any fluoride that's been bound to any of your organs that need it. So you can do a little test with the liquid iodine. If you haven't done that, you can put it on your arm and it'll stain dark and you can see how fast your body absorbs it. And the faster it absorbs it, the more iodine you need. So if it's gone in a few minutes, you really need that iodine. If it stays on for several hours or so, then you're not that deficient in it. Minerals. You want to take lots of minerals. You won't actually utilize your vitamins if you don't have enough minerals. So you can do fulvic acid. Fulvic acid is a organic fulvic and humic acid, and they help make your minerals colloidal so you absorb them better. Shilajit is Ayurvedic, is used in Ayurvedic medicine, and it's high in minerals and humic and fulvic acid, and it comes from the mountains up in the Himalayas, where years ago when the ranges crashed together and the organic matter got smushed between them, and it's decomposed, and it oozes out of the mountaintops. It's a black, tarry substance, and they actually discovered it because the goats on the top of the mountain were way healthier than the goats at the bottom of the mountain. They noticed the goats at the top of the mountain were eating this tar coming out of the mountains. Zeolite. Zeolite's a volcanic mineral compound. It's very prismatic, and it'll pick up heavy metals, the fluoride, parasites. It's a great detoxer. And by the way, a lot of these detox mercury too, which all y'all should be doing too, because you have a high exposure to mercury. And bentonite clay. Bentonite clay, you want a food-grade bentonite clay. And some people do a slurry of that and drink it first thing in the morning. The bentonite clay and the zeolite you don't want to do around any other supplements or medications because it will absorb those. Calcium, you want to take plenty of calcium. If anyone's deficient in calcium or any of these other minerals, the fluoride's going to have a harder effect on them. And you want your magnesium, and you want your calcium-magnesium ratio to be 2 to 1. And you want a good source of calcium. I actually prefer to take silica because your body will convert silica to calcium if needed. Because too much calcium can do in products, but you can. But it's good to take if you think you may be fluoride toxic. And selenium. Selenium is used in some of the enzymatic, a lot of them in your body, especially the one that converts T4 to T3. And also it's a component in the enzyme glutathione peroxidase. And glutathione is a great detoxer in your body. So if you don't have enough selenium, those will become inactive. You can do selenium. They say you can take 100 to 200 micrograms a day. You can also do 1 to 2 Brazil nuts a day. They're high in Brazil nuts. So if you like Brazil nuts, you can have those every day. These are just some of the ones I take. This is the Shilajit. You only need 1/4 teaspoon. I put that in my smoothie because it does not taste that great, but it's good. And zeolite. I keep that at the office because I take supplements in the morning. I take them at noon. So in the middle, I do some of the zeolite. And I do the glutathione. Every time I take mercury out of a patient, I go in the back and I squirt some glutathione in my mouth also. Turmeric. Turmeric's a wonderful herb. It's been used in Ayurvedic medicine for years. It's anti-inflammatory. It's used in cooking, the spice. The active ingredient is curcumin. and it actually neutralizes fluoride and protects the brain. One of the MDs he's a PhD, he's a nutritional expert. He works with a lot of cancer patients in town, and he gives turmeric or curcumin to every cancer patient there. Cilantro. Cilantro is a great detoxifier. Not only the fluoride, but it takes out mercury, radiation. And in fact, if you have mercury in your mouth, I wouldn't eat too much cilantro because it might release some of the vapors and go into your brain. But the doctor that I had lunch with, that's what his protocol was. He had his patients make a pesto out of cilantro and eat it every day. And you can also get cilantro tinctures. And cilantro is known to cross the blood-brain barrier, so that's good to help clean the brain out. Chlorella. I like chlorella. And you want a broken cell wall chlorella. It's a little green algae. That's a great detoxer too. It does heavy metals and radiation and fluoride. And you can get a powder form, you can get little capsules, or you can get the tablets. I just throw it in my green drink every day. It's full of B vitamins too. Tulsi or holy basil, it's another Ayurvedic herb. And most Indian families will have tulsi plant in the front of their porch or in the courtyard. And it's very good detoxer. It helps increase the urinary excretion of fluoride, and it helps clean out the pineal gland. You can also do the oil. I have some of the oil sometimes. I'll put it right there and there, and especially if I'm meditating sometimes, and help clean out that pineal gland. Tamarind. Tamarin's a fruit that's native to Africa. Now it's in Eastern Asian countries and Latin American countries and the Caribbean, and it's a sweet little fruit. It grows on these pods on this tree, and they use it in sweet and savory dishes. But they can make tinctures out of the leaves, the fruit, the bark of the tree. It's very detoxing. It helps increase urinary excretion of fluoride also. And you want your antioxidants. Vitamin E and vitamin C, both of them help because the fluoride is so pro-oxidant. And the FRD fluoride tea, that's one of the few things I've seen. It's from Hannah Kroger that detoxes tea, and it's a combination of nettles and chamomile and dandelion. And anyone familiar with Hannah Kroger? She was this little German lady that came over here in the 50s, and she was appalled at how unhealthy everyone ate. So she started she had actually opened the first health food store in Boulder, Colorado. And she was a little spitfire, apparently. She could just look at you, tell you what was wrong with you, and tell you what herbs to take and heal you. And so she has this fluoride detox tea, but also one of her big things is if you have any patients with leukemia, she says she had a 96% success rate of healing leukemia by adjusting the tailbone. And you can Google on YouTube tailbone and leukemia and Hannah Kroger. And you can have two people, you can do it on someone else and adjust the tailbone. You move the leg around and adjust it because the tailbone, the coccyx has to be pumping to get the bone marrow working right. And if there's something wrong with it, it won't function right and you can end up having leukemia. And all my patients that have leukemia say they fell on their butt at one point or time, on a slide or off a horse or something. It's amazing. So I highly recommend that, checking out that video. So here's the chlorella. This is the one I do. It comes in all forms. And I just throw it. This is just the powder. Also, when Fukushima happened, I went across the street to the pharmacy by my office, and I grabbed the chlorella because I knew that the one I got there was from Japan, and got it. And I don't get any from Japan right now anymore because it does absorb radiation. And here's the holy basil, the tulsi, and it's just 1/8 of a teaspoon. See, this doesn't taste that great either, but it's good for you. Here's Hannah Kroger's tea, the FRD tea, and you can get that online. So you want to eliminate exposure. You don't want to have it in the first place. So eat organic foods as much as possible, and non-GMO foods. You know how to check on the labels at the grocery store. If it's a 9, it's organic, on the little number system. My husband came home and said, I go, where'd you get those oranges? He said, my friend gave them to me. He said, they're organic. I said, no, they're not. There's a 4 right here. So I don't know who's fooling him. Eliminate your Teflon cookware. Don't even give it away. Throw it away because you don't want someone else using it. Just get rid of it. It's toxic. They have these really nice white ceramic nonstick pans that you can get anywhere now. Filter your water with reverse osmosis or special fluoride filters. The Brita filters do not filter out fluoride. A lot of patients think that they're getting the fluoride out with the Brita filters. The filters are going to have a piggyback filter to just get the fluoride. It's such a small molecule. It needs a special filter to get it out. And use your dental products without fluoride. The ways to prevent tooth decay without fluoride. Your diet. So reduce your sugar intake and your refined carbohydrates. Keep your body alkaline. That's with your fresh fruits and vegetables. Probiotics. The mouth is the beginning of the digestive tract. I tell all the kids, patients, to get on their probiotics, even babies when they're force born, especially if they're born with a C-section, because they're not getting inoculated with the vaginal bacteria. Start them on probiotics. I think Pharmax has a little one you can dip your finger in and stick it in the baby's mouth, because they say your gut flora is established by age 2. So, and also if you can't avoid any antibiotics by then, do that. And iodine. You can take it internally. You can take it on topically. There's a study showing that applying iodine to the teeth every 2 months is more effective than doing fluoride. So it kills. I actually flush cavitations out with fluoride. I mean with the fluoride. Oh God, no, with iodine before I. That'd be a good one. No, then bone would never heal. With iodine because it kills the bacteria so well. Probably the liquid. I'll show a picture in a minute. Let's see. Here is the probiotic I like. I don't sell any of these. This is just what I use at the office. So. This is really nice. They're in little blister packs, and the kids like them. They taste good, and it says on the back to brush your teeth before you go to bed, and then to chew one and keep it in your mouth and swallow. And they taste good, and I like them. They're great. The kids like them. On the probiotics, I recommend it to them. Yeah. Oh, sure. And that's from Zymogen. They're a great company. I like them. And you can just call and have them order. And here's the iodine. You can get it in a tablet form with iodoral. This is a Lugol's formula with the potassium iodine, and this is a liquid. I use this one for the cavitations. I also get, I don't know how it is in your state, but in Texas, Lugol's is prescription now. But I just call and get it for the office, so I have Lugol's. I do that in the morning. I do the iodoral at lunch if I think about it. Of this? I'm not sure. 2% or 5%. I'm not sure. Whatever. I use with this, and I put it in, and then I just flush it with other stuff. It's one of my flushing. And these, I use those small pills. Those come in a, the iodoral comes in a 25 milligram and a 12.5 milligram. And I start out with the low. If you start getting speedy and your heart pounding, you're taking too much iodine. You need to back off. So toothpaste. You don't have to have toothpaste with fluoride. And the toothpaste that will rebuild the enamel or the MI paste, y'all familiar with the MI paste? Uses the casein from the milk product to rebuild the enamel. There's the Carry-Free for children, the fluoride-free one. I wish it was a little cleaner. It still has some sodium lauryl sulfate in it. But I'll tell the patients to brush their teeth, and then if they have a certain area, like if they have some root recession, to rub it on there at night so they don't have it all over their mouth. But I like the Carry-Free because it does have nanonized particles of the hydroxyapatite, which is what your tooth is made of. And baking soda, you can do the old baking soda because it keeps your mouth alkaline. And salt. Salt actually will break the outer layer of the bacteria and kill it, the coating. And you can do the salt. That's the old salt and baking soda toothpaste. And you have your toothpaste that have probiotics, herbs, and essential oils in them. So there's your MI paste. There's the Carry-Free. And, oh, this is the local person. I think they're local to Austin. Just started making this magic mud. And this is basically bentonite clay and charcoal. And it is messy. If you haven't used it, you will be black. Your mouth is black. And of course, after I first used it, I read the direction that says, spit close to the opening of the sink because your sink turns totally black. But it really does whiten your teeth. I've seen patients' gums heal up nicely. And a lot of them say they do it in the shower so that it avoids all the huge mess. To the CTX. And there's Designs for Health has a toothpaste with probiotics in it. They have a watermelon that the kids like, and they have a fennel, and they have different flavors. And we use the Thieves products, the Young Living products at the office. The one on the right is a little more minty flavor. If y'all are familiar with the Thieves oil, it's very antibacterial. It has the combination of clove and rosemary and lemon and different essential oils that kill the bacteria. And at the office, for the hygiene, we use the Nada paste, which has just pumice in it, so no fluoride. And then we have the patient pick which essential oils they want in it. We also have cinnamon and spearmint. These are the main ones. The kids like the lemon and the orange, and the adults usually get the Thieves and the peppermint. Every once in a while, you know, the fennel, people love it or hate it. It's that black licorice thing. But they just open the Nada paste, put a drop or two in there, mix it with the Explorer, and then polish the teeth with it. And your rinses. You have the rinses containing essential oils and herbs, and the ones that contain hydrogen peroxide, or a combination of all of them. And then there's oil pulling. Y'all familiar with oil pulling? That's when you take, it's old Ayurvedic practice, and you take, it used to be a sesame oil, now a lot of people are using coconut oil because it's more antibacterial. You put in your mouth a tablespoon or two, swish around, swish, 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 5, 10, hopefully 20 minutes if you can. Don't swallow. So it kills the bacteria, it helps with the biofilm in the mouth. It actually stimulates the meridians in all the teeth, and it helps myofunctionally because you're exercising all those muscles. So I've seen incredible results with oil pulling on patients. I don't have the patience to do it in the morning too much, but sometimes I do it every once in a while. So that's the mouthwash with herbs, with the essential oils in it. This brushing rinse is great. This has some food-grade hydrogen peroxide and some essential oils and a little aloe vera. And O3 Dental Care, they have actually ozonated this coconut oil, so it has a double whammy. So when you're doing your oil pulling, you have some ozonated coconut oil. I don't know if are they going to be here today at the conference? The O3 Skincare people? Okay. Anyway, so your resources are fluoridealert.org. That's Paul Connett's site. Fluorideprotection.org. That's Ivan Estevez. He's done a wonderful website on how to detox and education about fluoride. And the book, The Case Against Fluoride by Paul Connett. The Fluoride Deception by Christopher Bryson. And Mouth Matters by Carol Vanderstoep. So I encourage you also to become active if you have a local fluoride-free group. To try if your water's fluoridated in your city, because I think we really need to get this out of the water and stuff. The children are the ones that have the most problem with it. And thank you. Y'all have any questions?